Good afternoon, and thank you for joining us for today's daily media briefing with London City Mayor Ed Holder and the Medical Officer of Health for the Middlesex-London Health Unit, Dr. Chris Mackie. We thank the media who are joining us and remind them that if we could have questions from each media outlet through one individual rather than several. We'd also like to welcome people who are joining us today on the Rogers TV network in London, on Facebook, as well as on the YouTube channel, and also for folks listening in on Global News Radio AM 980. We'll have an update in a moment from Dr. Mackie and Mayor Holder, but I do want to remind everyone that today's briefing will conclude at 2:30. I'll hand it over now to London City Mayor Ed Holder.
Thank you, Dan. And Dr. Mackie, it looks like it's now really now our full second week as we're doing this. And I was reflecting on the weekend that we've all just gone through, where people typically gather in families and in church and other celebration services. And I'd like to acknowledge everyone who paid heed to the provincial order to stay home, to watch your services if that's your direction and inclination on television or on the computer, and that and also to distance from family for this period of time. Look, that's not easy. I know, and we all understand that. But here's the thing: this has been several weeks now, and it's not a short-term challenge. And we do and are grateful for those who continue to self-distance, to do the hygiene that you've heard recommended from our medical officer of health, and do the things that you need to do. And yet we still found that in this past week, we had 13 individuals and businesses who received citations by law enforcement. That adds up now over basically what is the weekend before and now this, something over 11 days where we've issued 36 citations. And you know, when you got kids and the weather's getting better, I know that's just something that you think it'd be just great. And we're not saying don't go out, but what we're saying is self-distance. Don't play on those playgrounds. Don't play in those skateboard parks. You have to be so incredibly mindful. It's really easy to imagine that right now, while this has been going on for so many weeks, that we've almost accepted a new normal, so just go out and do what we do. We can't. We can't because it's not the right nor the healthy thing to do. For those who received citations, they'll know that the fines aren't cheap. But you know what isn't cheap? It's the cost of a human life, because that's precious, and we have that opportunity to impact. And we can make London proud just by doing the right thing. Now, the other thing I'll point out is that in the spirit of making London proud, I'm delighted that London's food bank, that virtual food drive that they had, is the most successful that they've had in its 34-year history. The food bank supports so many agencies around London and food banks in communities around London as well. What they did, though, just as good news, is they generated the equivalent of almost 190,000 pounds of food, and that's 3 times more than what was collected the previous year. So well done, London. You're so generous, and that need is so great, particularly when we note that we've had now an additional 300 families registering with the food bank. That's just in March. So Glenn Pearson, Jane Roy, to your staff and all the volunteers, thanks for doing what you do in London. That's you at your best. Thank you as well. And over to you, Chris.
Thank you, Mr. Mayor. So some really good news from the perspective of the data we've been tracking on this pandemic wave here in Ontario and locally. We are starting to bend the curve. We're seeing the dramatic increase in cases really start to level off now, and lots of different data points showing that although we may not be yet quite at the peak, we're close, and things are leveling off. That's great news because our hospitals still have plenty of capacity, and it looks very clear that the healthcare system overall will not be overwhelmed by this pandemic wave. So big credit to you, to everyone in the media and in the public who've been so helpful in helping to make sure that we are taking those physical distancing measures seriously, implementing those public health measures around closures, and really doing everything possible to protect ourselves and the people around us. This is a real win. We are bending the curve. That's the main message for today. It's really important that we keep going with those physical distancing measures and closures of businesses and schools, because this is not the sort of epidemic that will peak and then quickly drop away. This is the sort of thing that there's a slow burn at these elevated levels of illness. And so we have to keep doing the things we're doing in order to protect ourselves and our loved ones in particular. I'm going to leave it there, Dan. Happy to take any questions.
All right. Thank you very much, Dr. Mackie, and thank you, Mayor Holder. We'd remind the media that now is the time for you to send in your questions, and we'll direct them to either Mayor Holder or to Dr. Mackie as your question is most appropriate for both of them. Also wanted to mention something to you, and for those of you who are tuning in maybe for the first time, both Dr. Mackie and Mayor Holder and myself, we're all in different locations making this happen from several different places. And that really is part of the physical distancing that we've been talking about for some time now. And really an example of how we're using technology to communicate with the community in a way that keeps us all safe as well. So it's been a bit of an adjustment, but I think we're getting there. And certainly we've been hearing some good things, and we welcome your feedback. All right, we're going to get into the questions now. Dr. Mackie, the first question is for you, and I'm not sure if this is something that you have the information about, but the question is about the field hospital at Western Fair. Do you know whether it's been used or whether there are any patients there?
Yes, so the field hospital was originally set up. The field hospital was set up to make sure that if we have, overwhelming demand on the intensive care unit or ventilator capacity, that there is an option for patients. The field hospital has not been, at this point, has not been used. There is an ongoing discussion, though, whether it should be used as a COVID-specific location. Some places around the world have done what they call cohorting of patients to either a COVID-free hospital or a COVID hospital, which can help prevent the spread of the infection in the healthcare setting. Not clear that we will be going in that direction. There are lots of pluses and minuses on both sides of that, including, anytime you move into a new space, there's an adjustment period, people getting used to new processes, and it may affect efficiency and possibly safety as well. I noticed the next question around healthcare providers. We don't have accurate counts of healthcare providers at this point. We do have, some information, but on any given test, there's no requirement to record whether the test is being done for a healthcare worker or not. And so we could give, some estimate of things that have been done through occupational health and safety, for example, but that would miss out on anyone that has gone straight to an assessment center or anyone that might be in hospital, a hospital that they don't work at, where the organization wouldn't even necessarily know that they're a healthcare worker.
Great. Thank you very much, Dr. Mackie. Another question for you. This one is from Dan Brown at the London Free Press. Could the peak of the outbreak come this week?
The peak of the outbreak sure could come this week. I'm certainly not going to make that call today to say for sure it will. There are even some models that have been saying that the peak has already passed in Ontario. Models have lots of limitations, as we've discussed here before. It's clear that we are at a high disease level and that we will stay at a high disease level, relatively high, for the next few weeks. We will only really reliably know that the peak has passed probably a week or two after it has passed.
And if I might add to that, to what Dr. Mackie has said, and he's quite right, the truth is we just don't know, do we? And so what we're doing is that's why we need to take all the precautions that the Middlesex-London Health Unit has been pushing us to do, that the Premier of Ontario has pushed us to do, that my office has pushed us all to do, to make sure that until we know, we have to assume that the most challenging situations could well still be in front of us. And it's why we will still be vigilant in our bylaw enforcement, and why we will still ask Londoners for their great cooperation in doing the right thing. And you've seen it in terms of the hours that have been extended to seniors so they can do some private grocery shopping, for example, and limiting one person to do shopping instead of many, and to self-distance, the things that the health unit has talked so articulately about. So those things we're going to carry on, and until we're advised by the medical officer of health differently, that will be the direction that we take.
All right, thank you both very much for that answer. Dr. Mackie, we've got another couple of questions coming up for you. And the question is about a test that has come back positive for a healthcare worker at the St. Thomas Hospital, and sort of bringing that back to the Middlesex-London context. Do we know what the hospital protocols are in place if a staff member should test positive?
So there are a couple of protocols that come into play. First of all, from a public health perspective, the protocols followed with a healthcare worker would be the same protocols with any other infected individual, and that is we look for close contacts, people that have spent really close, face-to-face time, and usually a significant amount of time, and we would, through that individual who's sick and or their family, gather any information on close contacts and be directly in contact with those individuals. Make sure that they know they need to self-isolate, and if they have any symptoms, they need to get tested. So that would be the process in hospital as well. If the person in hospital was caring for individuals who were otherwise vulnerable, perhaps they had immune compromise or some other underlying disease, the threshold for notifying them may be lower, so that we would usually want to see sort of a half an hour of face-to-face contact in order to be considered a close contact. Whereas in the hospital, you might go there even if you've had less of a prolonged exposure in an individual who's at higher risk of catching the illness. The second protocols that come into place are around the hospital's own or the institution's own reporting policies and their approach to transparency. There certainly could be a benefit for the organization to making sure that their staff is aware of what is happening. It's always better to hear that information directly rather than to hear it through the grapevine. And so that would be something that the institution itself would have to consider.
All right. Thank you very much, Dr. Mackie. I know that you like the three-part questions, so we're going to throw one at you, or three here, from Sawyer Bogdan, who is with Global News Radio AM 980. Sawyer has three parts to her question. First, Dr. Mackie, should people without symptoms who live in long-term care homes be tested? Second, are there any worries of long-term care homes becoming short-staffed? And third, are there safeguards in place to ensure that what happened in the Quebec retirement home does not happen here? And I'm not sure exactly what happened with that one, but I will leave it to you.
Yeah, I think I know the case that we're talking about. So first of all, should people in long-term care homes who are asymptomatic be tested? It's the guidelines at this point set a very low bar for testing in long-term care homes. In other words, basically any new symptom could buy you a test for coronavirus in a long-term care home. And that's because the residents are at such high risk. You absolutely need to know if somebody is positive and as early as possible in their symptoms. For example, you've had some case reports that up to 50% of people with coronavirus actually have diarrhea before they develop respiratory illness. And so, in a long-term care home, that early symptom would be enough to get you tested. And we're working with all of the long-term care homes and retirement homes across the region to make sure that they have the right testing protocols in place and they have the equipment and skills and processes to get that testing done. Second part of the question was about, I missed, it's been published over here.
Do you expect that number to continue to rise?
Are there any worries of long-term care homes being short-staffed? That's definitely something that we are watching closely. The whole system is watching that closely. It's an issue that we raised early last week because in order to prepare for the peak, hospitals have been directed appropriately to what they call decant patients out of the hospital into long-term care or retirement homes or other places that could care for them in order to make sure there was space available for the peak of coronavirus. It's now clear that the peak, whether it's now or soon, will not reach the levels that were required or that were predicted in some of the models that said that you would really see an overwhelmed hospital system. So right now we have lots of capacity in the hospitals sitting, there's lots of capacity in the hospitals right now, but long-term care is a chronically stressed system, and now is stressed somewhat more because of that decanting. So the hospitals and long-term care and the whole system are looking at ways to address that. The question about what happened in Quebec, and I believe it was in Montreal, you had a situation where there was an outbreak happening, and so many staff were ill with coronavirus and others afraid to come into work that they really had critically low levels of staffing in the facility. That's the nightmare scenario that we're all working very hard to make sure we avoid. And the system is working as a system more so, I believe, than ever before to make sure that that doesn't happen. Hospitals helping long-term care and vice versa, all of us working together to make sure that the most vulnerable residents are protected as much as possible.
All right, thank you very much for that, Dr. Mackie. Next question, I'm going to ask both of you to answer. This is coming to us from Torstar Community News. And the question is this: a recent poll has found that 26% of Canadians are not properly following social distancing rules. Why do you think that is, and how can people do better? Mayor Holder, if you'd like to start on that one.
I'm not going to speculate on what that number might be in London. All I can look to are the issues that we have dealt with in terms of education. And the health unit, as well as the city, have stressed time and again the importance of self-distancing, the importance of hygiene, staying at home unless you're part of an essential service, doing those things right. And I would say that the rate of compliance in our community has been pretty high. The challenge you get is when people look at the weather and say, oh, we have to get out, we have to, I don't want to say break the rules, but we have to go beyond what we would normally do in these at this particular time. Or that they'd say, oh, you know what, this is the same thing every day, I need to do something else. We cannot take our eye off the ball. This is too critically important. If we're on the edge of getting close to getting to that peak or getting through that peak and dealing with it, it's because of the behaviors that have been shown consistently over the last several weeks as we have promoted this. But you've seen with the almost 40 citations between individuals and businesses, we're not, that some people still don't get it. There was an example with one of our city councilors who shared with me that he saw several young men near his home, arms around each other's shoulders and sharing cans of pop, and just insane. I mean, it's just not the kind of behavior that, if you imagine, not only is it not safe and not smart, but you take it home, and then one of your parents then visits a grandparent, and that individual can be responsible for somebody's death. I mean, that's how serious this truly, truly is. So to get to the point where we look to be optimistic about the numbers going forward, we need people to be as vigilant today and next week as they were yesterday and the week before. And to those who don't mind paying a fine close to $1,000, because the fine is about almost $900, I suppose. Look, there's no sense of entitlement here. You don't go on the public playground. You don't go in the skate parks. You don't play basketball. You do the smart things. And while I'm preaching pretty hard for compliance, because we need to remind people, and we need to remind parents to remind their kids in terms of right behaviors. For the most part, I think Londoners have been great, and we honor that.
Dr. Mackie.
Not much to add. I think the mayor's done a great job of addressing what is, at its core, a political problem. I would point out that 74% of people are following those guidelines, which is an enormous accomplishment given how much change we've asked people to implement in their lives and how quickly. So if this were an election, physical distancing and public health measures are winning in a landslide, and that is what is bending the curve right now in Ontario.
All right.
I would take 74%, let me tell you. But I'm not
All
running.
right. All right, Dr. Mackie, we've got another question for you, and this one comes from Sophia Rodriguez at CBC London. It's another three-part question. There was a big increase in the number of long-term home cases that were part of the case update today that was posted to the Health Unit's website. Do you expect that number to continue to rise? That's the first part. Second part, what do you say to family members who are worried about their loved ones at these homes? And finally, what is being done to keep as many people safe?
Sure. The large increase, the significant increase in long-term care homes over the weekend was likely around that increased testing. We did send the new protocol out over the weekend, last week, and over the weekend made sure that long-term care homes had swabs so that they could do that testing right on site. And that's great. We're now picking up those cases earlier rather than later and able to isolate people earlier rather than later. So from a public health perspective, that is a very good thing. Second part of, that was the preamble. The first part of the question was around, do you expect the numbers to continue to rise? Well, they can't go down, right? These are cases we're counting going forward. Are we going to see that accelerate? I wouldn't say so. There are a number of important measures being put in place, which is, I think, the third part of the question. First of all, you've got cohorting of staff, which is where facilities are limiting, the number of places in the facility where an individual works, and also limiting the number of locations where that individual works in terms of the number of facilities they work at. So, for example, Dearness, the city-run facility, has told all of their staff, you can't work here if you're working somewhere else. And that's to prevent the spread from one place to another, and it's a really important measure. Second, we're testing all new admissions to long-term care facilities, even if they don't have symptoms, so that we can catch people who might be coming from the community or from the hospital that might be infected. And in spite of those test results, even if the person tests negative, new admissions are being isolated in their own room for the first 14 days of their admission as a sort of a quarantine period within the long-term care facility. All sorts of measures to increase hand hygiene and availability of hand sanitizer in those facilities. Very important move last week to ensure that people in long-term care facilities, all staff, are wearing personal protective equipment and really masks to make sure that if they have symptoms, whether they are coughing or sneezing or speaking moistly, that they are not passing those symptoms on to the residents of the long-term care facilities, because those people are so vulnerable. The question of what do we say to family members, this is an important time. Family members are actually playing a key role here by limiting their visits. That's one of the things that I think can be really hard for family members to do, because they do want to see their elderly relatives. But people have been willing to comply with the recommendation to limit all visits to only those really essential visits. And even trips outside of the home for residents have been limited or eliminated as well.
So, right. Dan, a question, is Dr. Mackie going to break into song again?
I actually wondered that a little bit as well. I did, after our last media briefing, go and watch the song. So I thought Dr. Mackie's rendition was quite good last week. So yes, we'll have to work on that one. Dr. Mackie, a bit of a technical question coming in from Grant Demi at MyFM in Strathroy. Grant would like to know the responsibility of a citizen who may or may not have come into contact with an essential service worker who later tests positive. Should those citizens self-isolate even if they show no symptoms and aren't sure if they were in contact with that said employee?
Yeah, we get a number of questions around, well, was I one of those patients, or was I on the bus with the person who was sick? The answer is always the same, and nobody particularly likes the answer. But the truth is, if you did have significant close contact, that would deem you to be, that would make you, meet the definition for a close contact of that individual, we will find you and we will inform you and we will make sure that you have the information needed. And that includes self-isolation. So yes, if you had significant close contact with somebody, enough to meet the case definition as a close contact, then we'll trace you down and we'll help you get what you need in order to be isolated. We're not releasing the names. We're not releasing any details that would be enough for individuals who are unaffected to be able to identify the identities, because that's personal health information and there isn't a public health reason to do so. So we can't under our legislation.
All right. And we have one last question, and Dr. Mackie, it is for you, and it's from Dan Brown at the London Free Press. Dan would like to know if it is your sense that people stayed home on the Easter weekend and didn't violate physical distancing guidelines.
Dan, great question. It's not one that we have great data on. We certainly, and I know the mayor and other city councillors are in close contact with religious leaders in the community in all three of the major faiths that had significant holidays over the weekend. And we have not heard, at least at the health unit, of any significant violations of those directives around faith communities. We do hear anecdotally that some people might have gone to the cottage for the weekend, but really don't have like a kind of comprehensive answer to that question.
Dan, I wonder if I could add to it to help Dan, who asked the question, and that is a few weeks ago we had a conference call with about 80 faith-based leaders, and at that time what we did was we determined that they were going to be doing all of their sermons online, access that way, doors would be shut. There was some limited discussion around some of the community service work they do, but ultimately what we had was absolute 100% compliance with our faith-based leaders, not just for Easter weekend, but with Passover and Ramadan and the various, and next week the Orthodox Easter. So there are a number of celebrations where typically people would get together. But I'd like to thank the faith-based leaders across London and broadly throughout Middlesex County who have been so strongly supportive of this direction to do their services online and minister to their congregation that way. We are very, very grateful.
All right. Thank you both for that. And we did just get a question just under the wire, and that is from Steve Young at CTV. And Dr. Mackie, it's a question for you. COVID-19 has taken its toll on all of us, especially those on the front lines. What's the best advice you have for those who are finding it difficult during this time?
Yeah, thanks for that question, Steve. And we certainly are hearing from some of our staff, but also across the whole healthcare system. There's a lot of stress. People in particular who have had to work in those environments where there are cases positive, being concerned for the safety of their families. Lots of people taking important measures to protect their families. We're doing something called work-home isolation. So rather than just home isolation where you've got an individual who's sick staying at home, those that are working in those high-risk settings isolate themselves as much as possible, even when they get home. Although they are still going to work and returning home, they try to keep distant from their families as much as they can within the home environment. And yeah, that is really, really difficult to stay physically distant from your loved ones. Important to keep them safe, and also not an easy one. I think the best, most important message is that this is not going to last forever. We are seeing the light at the end of the tunnel. We will be through this in a matter of weeks and not months in terms of those really restrictive physical distancing and public health measures. The other side of it is that, many people have had to try and find new ways to keep up their mental health, whether it's taking up a new hobby or getting back to something they've done in the past, or trying to find a way to do physical exercise even though your gym is closed. Those things are key, and The key things to mental health in the long run, it's difficult to change the stressful environment. That's a big factor right now. But getting a good night's sleep, eating well, trying to get some exercise, connecting with loved ones however you can, even if it's over Skype or a Zoom call or something like that. Those things all can make a difference in terms of mental health in the long run.
Thank you very much, Dr. Mackie. Mayor Holder, did you want to comment on that last question?
I think that's covered it with one point that I think is important. We know that a number of people in the course of the work where they go back and forth, and Dr. Mackie made reference to those folks that when they get home that they self-isolate as best they're able. It makes me think of how those people get home from work, and so many of them use transit, and this gives me a chance to say thank you and a shout out to our operators, because they're the folks that get our people to work, and in particular our healthcare workers, who I'd like to point out it's so important. Often that's the only way they can get to and from work, and so those bus operators are doing the very same thing that we're asking our other frontline workers to do, and that is to be safe, and also to be mindful as they go home to their loved ones. So we want to say thank you to them as well for the great work that they do, and I think Chris has articulated the balance of that message very well.
All right. Thank you very much, Mayor Holder. And Dr. Mackie, thank you for your time. And we will be back tomorrow with another daily media briefing. We'll start at 2 o'clock, and we hope to see you there. And a reminder that we will be joined on Thursday by the Warden of Middlesex County, Cathy Burghardt-Jesson. Thank you for tuning in, and we'll see you all tomorrow.
Thank you.